In the winter of 1906, Dr. James Thornfield heard something that would haunt him for the rest of his life. Voices speaking in languages he couldn't understand, echoing through the walls of Albany's most respected medical institution. What he discovered in those forbidden files would expose a horror so methodical, so calculated, that even today, the truth remains buried in the basement of what was once Thornfield Hospital. But before we uncover what Dr. Thornfield found in those walls, I want to ask you something. If you're fascinated by these dark medical mysteries from our past, make sure to subscribe to our channel and hit that notification bell. We bring you the most chilling stories that history tried to forget. And tell me in the comments, what city and country are you listening from? I love connecting with fellow mystery lovers from around the world. Now let's dive into this disturbing tale from Albany. According to the scattered records that survived the hospital's closure and the testimonies passed down through local immigrant communities, the mystery of Thornfield Hospital began with what seemed like noble intentions. Albany in 1906 was a city transformed by the great wave of European immigration. The Hudson River port welcomed thousands of Italian, Polish, Hungarian and German families each month, all seeking the promise of American prosperity. These newcomers, many speaking little to no English, crowded into tenements in the city's lower districts, struggling to adapt to their new homeland while preserving the traditions of the old country. Thornfield Hospital stood on State Street, an imposing four-story brick building that had served Albany's medical needs since 1882. Its Gothic revival architecture, with tall, arched windows and limestone trim, gave it an air of respectability that attracted the city's most prominent families. The hospital's reputation was built on its progressive approach to medicine and its charitable work with the immigrant population, or so the public believed. Dr. James Thornfield had arrived in Albany that September, fresh from his medical training at Johns Hopkins. At 32, he was ambitious and idealistic, drawn to the hospital that bore his family name. A distant relation had been among its founding benefactors. He accepted the position of assistant administrator with enthusiasm, eager to modernize the institution's practices and expand its services to the growing immigrant community. The hospital's staff of 12 physicians and 30 nurses prided themselves on their advanced techniques. They boasted one of the most modern surgical theaters in upstate New York, complete with electric lighting and the latest sterilization equipment. The first two floors housed general medical wards, the surgical suite, and administrative offices. The third floor was designated for specialized care, though few staff members had occasion to visit those rooms. Dr. Samuel Pierce, the hospital's chief of neurology, had been with Thornfield since its earliest days. A man in his 60s with silver hair and wire-rimmed spectacles, Pierce commanded respect throughout Albany's medical community. His research into mental disorders and neurological conditions had earned him recognition in medical journals across the country. Pierce maintained a private practice alongside his hospital duties, treating the families of railroad barons and state legislators who could afford his specialized care. What struck Dr. Thornfield immediately was the hospital's unusual patient demographics. While Albany's immigrant population made up nearly 40% of the city, they represented almost 70% of Thornfield's admissions. Most came through the charity ward, many unable to communicate their symptoms in English, relying on hand gestures and the occasional translator from their ethnic communities. The first time Dr. Thornfield heard the voices, it was during his third week at the hospital. He had been working late, reviewing patient files in his office on the second floor, when a sound drifted down from somewhere above, a low murmuring that seemed to emanate from within the walls themselves. At first, he dismissed it as the building settling or perhaps steam moving through the heating pipes. Thornfield Hospital, like many buildings of its era, had its share of creaks and groans. But as Dr. Thornfield sat in the silence, the sound continued. It wasn't mechanical at all. These were human voices, speaking in what sounded like foreign languages, possibly Italian or Polish, though he couldn't be certain. The voices carried a tone of distress, sometimes rising to what sounded like pleading, other times dropping to exhausted whispers. When he mentioned the incident to Dr. Pierce the following morning, the older physician's reaction was curious. Pierce paused in his examination of a patient chart, his pen hovering over the paper for several seconds before responding. "Old buildings make strange noises, Thornfield. I've heard similar sounds myself over the years. The hospital was built on unstable ground. The foundation shifts with the seasons." But Dr. Pierce's explanation didn't account for the distinctly human quality of the sounds, nor for the way they seemed to follow patterns of speech rather than random building noises. Dr. Thornfield found himself staying late more frequently, listening for the voices and trying to determine their source. They seemed strongest near the stairwell that led to the third floor, though they were never loud enough to make out actual words. The third floor remained largely off-limits to Dr. Thornfield's daily rounds. Dr. Pierce had explained that it housed the hospital's most delicate cases, patients with severe mental disturbances who required absolute quiet and specialized treatment. "These patients are often violent or unpredictable," Pierce had warned. "It's better for everyone if we minimize disruptions to their care." 3 weeks after first hearing the voices, Dr. Thornfield encountered something that would change everything. Mrs. Elena Rossetti, a recent Italian immigrant, had been brought to the hospital by her husband after collapsing in their tenement. She spoke no English, communicating only through her teenage son, who served as translator. Dr. Thornfield was examining her when she suddenly gripped his wrist with surprising strength, her eyes wide with terror. Through her son, she conveyed a message that chilled Dr. Thornfield. "She says she knows this place. She says her brother Giuseppe came here 6 months ago for headaches. He never came home. She says she can hear him calling her name from inside the walls." In the weeks that followed Mrs. Rossetti's disturbing revelation, Dr. Thornfield began to notice patterns that had previously escaped his attention. Patient records showed an unusually high number of immigrant admissions that ended without discharge documentation. When he inquired about these cases, he was consistently told that the patients had been transferred to specialized facilities or had returned to their home countries for family reasons. The voices in the walls grew more frequent and more distinct. Dr. Thornfield began staying at the hospital well past midnight, positioned near the third-floor stairwell with a small notebook, attempting to document what he heard. The sounds came in waves, sometimes a single voice speaking in urgent, rapid syllables, other times multiple voices overlapping in what sounded like a cacophony of distress. During one particularly clear episode, Dr. Thornfield was certain he heard the name Giuseppe repeated several times, along with what sounded like Italian words for help and please. The realization struck him like a physical blow. These weren't random voices of current patients. These were recordings, somehow preserved and played back through the building's infrastructure. His investigation into the hospital's history revealed troubling gaps. Financial records showed significant expenditures for research equipment and specialized medical supplies that weren't reflected in the hospital's public inventory. Purchase orders included items that seemed unusual for a general hospital: phonograph equipment, wax recording cylinders, and large quantities of chemicals typically used in experimental procedures. Dr. Thornfield also discovered that Thornfield Hospital had been receiving substantial grants from the New York State Board of Health for neurological research, grants that were administered exclusively through Dr. Pierce's department. The funding, which totaled nearly $10,000 over the past 4 years, was designated for innovative treatments of mental disorders in immigrant populations. The breakthrough came when Dr. Thornfield gained access to the hospital's maintenance records. Under the pretense of investigating heating system inefficiencies, he requested blueprints and service documentation from the building's superintendent. a German immigrant named Klaus Weber, who had worked at the hospital since its construction. Weber, who spoke broken but understandable English, revealed information that Dr. Thornfield had not expected. "The third floor, yes, it has special pipes," Weber explained, pointing to sections of the blueprint. "Dr. Pierce, he asked for speaking tubes to be installed 3 years ago. Said it was for monitoring patients who could not use the call bells." The speaking tube system was far more extensive than Weber had initially indicated. The network ran throughout the 3rd floor and connected to several rooms on the 2nd floor, including Dr. Pierce's private office. But most intriguingly, the tubes also connected to a small room in the hospital's basement that Weber referred to as the listening room. When Dr. Thornfield asked to inspect this basement room, Weber became visibly uncomfortable. "Dr. Pierce, he said no one should go there without his permission. He keeps it locked always. Says it contains sensitive medical equipment." That night, Dr. Thornfield made a decision that would expose the true horror of Thornfield Hospital. Using a set of master keys he had obtained during his orientation, he descended to the basement and located the locked room Weber had described. The door was heavy oak, reinforced with metal brackets, and bore no identifying markings. Inside, Dr. Thornfield discovered a chamber that defied everything he thought he knew about his profession. The room contained a sophisticated array of recording equipment, Edison phonographs, dozens of wax cylinders arranged on wooden shelves, and a complex system of speaking tubes that connected to various points throughout the hospital. But most disturbing were the detailed logs that filled several leather-bound ledgers. The logs, written in Dr. Pierce's precise handwriting, documented hundreds of experimental sessions conducted over the past 4 years. Each entry included the patient's name, country of origin, the type of procedure performed, and detailed notes about the subject's verbal responses during treatment. The recordings, Dr. Thornfield realized with growing horror, were documentation of medical experiments performed on unwilling patients. The entries in Dr. Pierce's logs read like a catalogue of human suffering. Giuseppe Rossetti, the brother Mrs. Rossetti had been searching for, was listed in an entry dated March 15, 1906. Subject responded well to initial trepanation procedure. Verbal responses recorded for analysis of pain threshold variations in Mediterranean populations. Subject expired during secondary intervention. Dr. Thornfield spent hours in that basement room, reading entry after entry that detailed experimental procedures performed on Italian, Polish, Hungarian, and German immigrants. The treatments included primitive lobotomies, injections of experimental drugs, deliberate infections to study immune responses, and surgical procedures performed without adequate anesthesia, all documented with clinical detachment. The recordings themselves were even more horrifying than the written logs. Dr. Thornfield played several of the wax cylinders, hearing the voices of men and women pleading in their native languages, begging for mercy, calling for their families. The voices he had been hearing in the walls were these recordings, played back through the speaking tube system during Dr. Pierce's late-night sessions in his office. But perhaps most disturbing was the systematic nature of the operation. Dr. Pierce had been specifically targeting immigrants who spoke little English, knowing that their disappearances would generate minimal official inquiry. He had established relationships with certain boarding house operators and labor contractors who would refer troubled immigrants to the hospital for charitable treatment. The true scope of the horror became clear when Dr. Thornfield discovered a secondary set of records hidden behind a false panel in Dr. Pierce's basement office. These documents revealed that the experiments were part of a larger research project funded by several prominent New York families and medical schools. The goal, according to correspondence Dr. Thornfield found, was to develop more efficient methods of mental health treatment through experimentation on expendable populations. Just when we think we've seen it all, the horror in Thornfield Hospital intensifies. If this story is giving you the creeps, share this video with a friend who loves dark mysteries. Give it a like to support our content. And don't forget to subscribe to the channel so you don't miss more stories like this. Let's find out together what happens next in this nightmare that Dr. Thornfield uncovered. Dr. Thornfield's investigation reached its climax when he discovered the location of the actual experimental chambers. Following the speaking tube network through the hospital's basement, he found a hidden section behind what appeared to be a storage room. The concealed area contained 3 fully equipped surgical suites, complete with restraining tables, experimental surgical instruments, and preservation equipment for specimens. In these hidden chambers, Dr. Thornfield found evidence of the systematic murder of over 200 immigrants over the course of 4 years. Preserved organs filled glass jars that lined the walls, each labeled with the subject's name, origin, and the nature of the experiment performed. The level of organization was chilling. Dr. Pierce had been operating what amounted to a private laboratory for human experimentation, using the respected facade of Thornfield Hospital to acquire subjects and conduct his research. The confrontation with Dr. Pierce came on a snowy December evening when Dr. Thornfield returned to the hospital after spending the day documenting his discoveries. He found Dr. Pierce in the basement listening room, playing one of the recordings while taking notes in his ledger. When Pierce looked up and saw Dr. Thornfield in the doorway, there was no surprise in his eyes, only resignation. "I wondered when you would find your way down here," Dr. Pierce said calmly, setting down his pen. "You've always been too curious for your own good, James." Dr. Pierce's confession was matter-of-fact and chilling in its clinical detachment. He explained that his research was advancing medical science by decades, that the immigrants he had experimented on were contributing to knowledge that would eventually save thousands of lives. "These people came to America with nothing," he said. "I gave their lives meaning through science." When Dr. Thornfield demanded to know how Pierce could justify the systematic murder of innocent people, the older physician's response revealed the depth of his delusion. They were dying anyway, from disease, from poverty, from the hardships of immigrant life. I simply ensured that their deaths served a greater purpose. Dr. Pierce had been selling his research findings to medical schools and private collectors throughout the Northeast, earning substantial profits from his human experimentation. The speaking tube system allowed him to document the subject's responses during procedures, creating detailed records of pain thresholds, drug effects, and surgical outcomes that were considered valuable data in certain medical circles. The exposure of the Thornfield Hospital experiment sent shockwaves through Albany's medical and political communities. Dr. Thornfield's documentation, combined with the physical evidence found in the basement chambers, led to criminal charges against Dr. Pierce and several hospital board members who had been aware of the research. However, the full truth of what happened at Thornfield Hospital was never made public. Prominent families whose names appeared in Dr. Pierce's correspondence used their influence to limit press coverage and seal court records. Dr. Pierce died in custody before his trial could begin, officially from a heart attack, though some suspected suicide. The hospital closed permanently in January 1907, its medical license revoked by the state. The building was sold to a textile company and later demolished in 1923. The basement chambers were filled with concrete before demolition, ensuring that the physical evidence of Dr. Pierce's crimes was buried forever. Dr. Thornfield left Albany immediately after the investigation concluded, moving to California, where he established a small practice treating immigrant communities. He never spoke publicly about his discoveries at Thornfield Hospital, but colleagues noted that he refused to work in institutional settings for the remainder of his career. The families of Dr. Pierce's victims were never officially notified of what had happened to their missing relatives. The immigrant communities of Albany continued to whisper stories about people who had entered the hospital and never returned. But without official acknowledgement, these stories gradually faded into urban legend. The recordings that Dr. Thornfield discovered in the basement were reportedly destroyed by court order, though some historians believe that certain cylinders may have been preserved in private collections. The voices that once echoed through the walls of Thornfield Hospital fell silent, but the memory of their suffering remains embedded in the history of one of America's darkest medical scandals. This mystery shows us how institutional authority and social prejudice can create conditions for unspeakable horrors to flourish in plain sight. The victims of Thornfield Hospital were vulnerable not just because they were poor or sick, but because they were voiceless in a society that didn't value their lives equally. What do you think about this story? Do you think everything was revealed? Leave your comment below. If you enjoyed this story and want more horror stories like this, subscribe, activate the bell, and share with someone who loves mysteries. See you in the next video.